what you're trying to, what is it you're doing, if you have a better understanding of it, it's always easier to understand physiotherapy. As you all know, physiotherapy is fairly simple to understand. Actually, medicine per se is fairly easy to understand. It's not like theoretical physics or something like that. So, without much of ado, I'll just start with my presentation here. The first thing is I'm going to ask a lot of questions, and if it is, if you want to make this fun and enjoyable, you need to answer the questions, if you will. That will make it really, really fun. Now, the first question I'm going to ask you is write down whatever treatment techniques you can think of in anything, whether it is physiotherapy or in neurorehabilitation or in pain or musculoskeletal or in cardio. Just list down all the techniques you know, like electrotherapy, exercise therapy, and things like that. And I'll just give you 5 minutes to do it, or 2 or 3 minutes to do it, so that it's easy for us to understand. There is also a clicking sound. Can you try to find out why I'm getting that? If you want, you can also share it in your chat so that I also can see it. That what are the things you think is, or the different techniques you can think of. Okay, so there are few number of answers I'm getting. I just want to exhaustive list, not just one or two. I would just want to have an exhaustive list, right? But anyway, this is the list I have made. There may be a lot of things which I have missed, but just for an understanding that these are the list I have made. If you see all the list, most of the time when I go, this is the common talk I give. You can classify all these things into 2 types, right? It's fairly simple to do them into 2, even though a lot of people say this and that. Whole of medicine as such is, we can differentiate it into 2, but in physiotherapy it's fairly simple. Now, what I mean by that is, if I remove a certain type of treatment here, you can see I've also added muscle release. It should have gone this side, but it didn't. But anyway, assume that the muscle release is also gone to this side. What you will see is that manual therapy, electrotherapy, muscle release, stretching, rubbing. What I mean by rubbing is trigger point release, massage with stick and fork or something like that. All these things are how included in this. So I have put physiotherapy into 2 bubbles. One is active treatment, as you can imagine. These are the things I have put it in active treatment, and the other things as passive. What I mean by passive is, in a way, it's not easy to define, but the simplest definition I can think of is that passive is wherein you have your receiver of the treatment, if you will, is he is passive in nature. He is not actively involved in the treatment, if you will, right? Say, for example, if you're taking a drug for diabetes, right? I have diabetes and you take a drug for diabetes, That I think is a passive treatment. But at the same time, diabetes also consists of behavioral modification. Say, for example, you need to change your diet, you need to do your exercise. All these things needs active participation from your patient, right? So that's what I mean by an active and passive, because we need to have some sort of operational definition for all these things, I suppose. So if you add these two, I think you get uh, physiotherapy as such, right? But as you can imagine, I'm missing some part of it. There's a subclassification of active treatment, which I'm not going to go today, because the focus is something else, not on physiotherapy. I mean, on not just the neurology. I'm not going into that part of it. But one thing I have left out. Can you point out what I have left out? You can also think of it as a sort of a part of active treatment. So what I have left out. Can I just put it in the chat? Okay. Right. That's a wonderful answer. So we are getting, we may also get active assisted also, right? So if you look into all the physiotherapy techniques, it should be inside this. There is no way it is outside this. And I'll also tell you how I came to this particular point of view. I'll try to show you a lot of techniques, and we will try to find out whether this is coming inside this itself. Right. So the next question you should obviously have is, what I'm going to do with this? Sure. Probably my net connection is not that stable. I'm not sure. Is it okay now? Okay. I think I got disconnected. Right. Am I? Yeah, sorry. Hello. Sorry. I think I lost my net connection. That's all. Right. So, what I'm going to do with this information is the most important thing. Because you remember, if you are classifying a disease, why do you classify a disease? Because we classify a disease because in accordance with the classification, we have a treatment program. For example, what's the value of classifying a nerve injury? We know that if it is a simple compression, it will recover by itself. So most of the time you don't need a treatment. If it is a complete cut, probably you need a surgery. If it is a halfway through, probably it will again recover by itself. Right? So anything you understand, you learn, should have some value in terms of how this is helpful for your patient care. Right? Otherwise, this is of whatever you're learning is of no value to anybody. Right? So in the next half an hour, something like that, I'll try to make you understand how this is going to help you in your patient care. So to understand, if you want to understand what treatment we are going to give for what type of disease, it's fairly simple that you need to understand the disease first, right? There is no major issue, I suppose, with all these things. But even though it's a simple lesson, a lot of people tend to miss it out. I'll just try to find out, or just try to explain what we are missing. Now, if you if you see that there are diseases which affects your spinal cord, there are diseases which affects your primarily your not. I'm not saying that the spinal cord does not affect your muscles or something like that. அந்த ஒரு மெயின் ஒன்று இருக்கும் பாரு, அதே கீழே இறக்கி விட்டு. Are you sure? so some disease which primarily affects your spinal cord, like your uh, spinal cord injuries or your Guillain-Barré syndrome, that kind of diseases. Then you have diseases which primarily affect your brain, and you have musculoskeletal system, probably your peripheral nerves also. Now, why I'm trying to say this is, even though this is a fairly simple idea, a lot of people seem to have uh, sort of rudimentary ideas about each system, and they have a very reductionist view of the human physiology. I'll just give you a simple example. A lot of people think that pain is a musculoskeletal problem, which is one of the uh, probably the most nonsensical term you can think of, because by definition, pain is an experience, pain is a perception. Pain is, if it is an experience and a perception, your muscles can't perceive or they cannot experience anything, right? So a lot of people have this misconception that each systems are working separately. But so what I'm trying to say is we need to have a clear understanding what system you are trying to change and what system are primarily affected. Remember, in stroke also there may be some changes in your muscle also, but primarily it's a disease of the brain. Likewise, uh, if you have mm, if you have a pain, even though it affects to a certain extent the muscles and things like that, it is again a primarily, the, if you will, a disease of the brain, right? Again, why do we need to understand these things is, if we don't understand that, then we'll have some some rudimentary techniques which we think is uh, advanced or something like that, right? So, if you have a treatment technique, so we know now first that we have classified it physiotherapy into two types, that is active and passive. And then we said that we need to have an understanding of what system we are trying, what system is affected in that particular disease, so that we can go and intervene or sort of correct that system, if you will. And the last one is what are the things you want to ask yourself before understanding any treatment, right? Most of us are seeing treatments, especially in the era of Facebook and things like that. We see treatment as though we see circus, right? We see them doing some circus and we think, ooh, and things like that. So, so I have some three simple things which you need to ask yourself if you have a treatment. What does the system what the system does this treatment change? Say, for example, if you are giving, say, for example, stretching, right? What system are you trying to change? Are you trying to change the muscle, or are you trying to change the brain? If you are trying to give ultrasound, what are you trying to change? Are you trying to change the local chemistry in your muscle, or are you changing something else, right? So you need to have that clearly in your mind. Again, it looks very simple. I'll tell you why this is a huge headache for, or why this is not mostly followed by a lot of people. Now, the next thing is, okay, I want to change the local chemistry. Then, is that the system which is affected in that particular disease? And then the last thing, which is the most important thing I want to emphasize is the half-life period of disease. So I'm not sure how many of you can remember half-life period. Basically, it means any substance you have decays into half, right? So if you have 100 grams of radium or something like that, what time it takes to become to 50 grams, right? That is basically half of it. What is the time taken for that? Likewise, for all the drugs, which we take externally, have a half-life period. Say, for example, if you have a painkiller, right? Any painkiller, all the painkillers are nearly same if they are NSAID. If you take an NSAID, most of the time the half-life period will be around probably 3 to 4 hours. That's why they tell you to take after each food, right? Because it goes down afterwards. It doesn't have any potency. Likewise, if you see in physiotherapy, I'll give you a simple example of levodopa. You will see that they will start with probably once daily. That means that the levodopa has syndopa, whatever they are giving, has a half-life period of 24 hours. As the disease progresses, the half-life period of the drug will also get less and less because the system is not or in need of a lot of levodopa, and it is not able to maintain it with that levels itself as we get more and more. But if you ask anybody doing a massage or rubbing or you're given a lot of examples of PNF or kinetic chain, whatever that means. Nobody asked this question, how long will the effect be? We have very little understanding of those things, and again, that is where we have a lot of confusion, right? We see treatment as again circus because of this particular question, right? So what I'm going to do is I'm going to sort of explain these three parts, these three questions for the next half an hour, right? So what system does it change is the first question I'm going to take. Now, you can take the human system as a whole, a single system, or you can have subsystems in that, right? The human being is a whole as a system, and then you have subsystems. Like say, for example, you have a computer. The whole computer is a system. Then you have motherboard. Then you have the RAM. You have your screen and the processor and the mouse and things like that. Likewise, you have a lot of systems in your body, and what systems can you change? That is the question we are asking, right? And whenever we think of what systems can be changed, again, I have made a sort of a simple classification of central and peripheral. This is not an ideal way to classify, but just for our understanding, it's easy for us to understand. Because a lot of systems or a lot of therapeutic systems we use or have a sort of a peripheral issue, if you will, or that's what they claim at least, right? So I have used that to make us understand about that, right? So what I mean by peripheral is are we changing local inflammation? Remember, a lot of people think that we can improve healing or things like that, which is one of the most stupid things you can understand. Have a misconception in medicine. You cannot heal anybody. Healing happens naturally. You can give an environment which is in such a way that healing happens in good time or in its natural time, right? So what we can do is you can reduce the local inflammation to a certain extent so that you are feeling better. Not that you are going to heal faster or something like that. You feel better, right? You are not healing anything, right? Um, and the next one is the lot of things which we keep on talk about is uh, it changes the circulation, changes the temperature, and removing stuff from that particular place. What I mean by that is prostaglandins, cytokines, all these things are part and parcel of how you transmit pain, right? So, are we removing them? It can also be removing about in cardio about the sputum and things like that, right? So those are the what I mean by peripheral. And nowadays, a lot of people are thinking that they are correcting biomechanics and changing length of the muscle. I'll tell you why I have put question mark in that also, because that's again is what is ruining physiotherapy. Now, what I mean by central is fairly simple. What I mean by that is you have uh, you have you're changing the brain as such. That's what I mean by that. And you are also changing emotion, cognition, uh, and in simpler terms, what is changing in your brain is you sensitize the brain, you accommodate the brain. There are also a lot of hormonal changes in your brain, right? Now, as I told you, this is a fairly how shall I put it? A very artificial classification, right? This is not a true classification. It's a sort of an artificial classification. Why I'm saying that is, if you are doing an exercise, right? If you are doing, say for example, sit to stand for 10 times, you will change your brain as well as your peripheral structures, right? It is never just the periphery or never the central, right? Likewise, if you look at this picture, if you are doing an exercise, all the systems from the endocrine to the skin to the skeletal, the cardiovascular system, all system changes. And that's the most important thing for us to understand, right? So the first question you want to ask yourself, based on the classification of what we have done, is what treatment gives change to the whole system? What I mean by whole system is the whole human body. Which system does that? And you will end up always with this. We will again go back to our original picture, right? So if I have all these therapies I have written, and again we have moved, again I should have moved the muscle release also here. What system do you think is most probably going to affect the whole system? Whether it is the active treatment or passive treatment. You can please send in your answers through the chat. Am I clear with my question? Right? Very good. So, some of you have, okay, not some of you, most of you have said that the active treatment changes the whole body, right? We know that very clearly. An active treatment, passive treatment changes the whole body. How do you know? How do you say that? I'm not sure. Right. So, that is the first value you get from having this classification. Whenever you are trying to change the whole body, you are going to use an active treatment. You are not going to use a passive treatment. Say, for example, if you want to run faster, nobody is going to use any of these things, right? If they have a brain, they are not going to use this. They are going to use some of these things, right? Not all of them, right? Likewise, if you are going to walk faster, better, right? You are going to use the active treatment. You are not going to use the passive treatment. Now, this is the problem. One of the problems in cardio, which mostly I don't talk about, is removing secretion, increasing breathing, and things like that. And a lot of people think that breathing exercise is some sort of godsend or some some sort of exercise per se. But if you make a patient walk 5 feet, they will breathe deeper than any breathing exercise, right? Their lungs will expand far better than doing any PNF, right? So that's why if you see the passive techniques like clapping and vibration, which we have not mentioned here, are not as effective as making patient walk in an ICU or make them sit or mobilize them basically, right? To if they are lying down, making them sit and then lie down back, those things are far superior than passive techniques like clapping and hacking and things like that. Because if you stand up or when you are lying down for some time and if you are made to prop to sit or stand, you get huge amount of physiological changes rather than doing this for half an hour, right? So always an active treatment wins in any situation, whether it is cardio or neurology, right? Now that is how I always look at the treatment, whether it is active first. If it is not active, mostly it doesn't deserve my time, right? Even if it deserves my time, I can understand that in 2 minutes. I'll tell you how I can understand in 2 minutes also. Right. So these are the next question I'm going to ask you is, right, so if I do any of these things, what system do you think it will change? Will it change the whole system or just a few systems? As you have correctly pointed out earlier, they may not change the full system. They may change just the peripheral issues most of the time, right? Remember, it also has some central issues, as I already pointed out. If you touch somebody, right? A lot of people think that you are treating the muscle. If you touch somebody, the first thing you get is it's an impulse to your brain. If there is an impulse to your brain, the brain assesses that impulse and thinks it whether it is good or bad, and then produces or secretes neurotransmitters accordingly. So whenever you are touching your patient, even though we think that it is a peripheral issue, it is mostly a central issue also. But anyway, most of the time these things I have are mostly about this part. They are always talking about this. Whether it is the fascia they are trying to lengthen, or they are correcting the biomechanics, something like that, that's what they are always saying. So we'll just look into each question. What are things which can be done? Now, if you look into the peripheral changes I have given, now I think these are the whether these can be changed. That's the first question I told you we need to ask. And if I ask this question, if I look into the physiology and physiological experiments, you tend to have an idea that probably you can change some of it, not all of it, but some of it. Probably you can change your local inflammation via increasing circulation, whether it is doing rubbing of your muscles or putting heat on it or putting ice on it, something like that. So you can change this part of it. Removing stuff, as I told you, you can again do it via circulation or through clapping, hacking, that kind of maneuvers also you can change. But one of the common things we tend to do is we think that we can change the length of the muscle and we can correct biomechanics, which is not possible at all. So that is where I'm going to spend some time on, because a lot of people have a poor understanding of these things, right? So I'm going to stop the slide for some time, and I'm going to use the video. Before that, if you have any questions for what we have done until this point of time, I will be happy to answer, and then we will move on to the next part. Yeah, I got one. So why we can't change the biomechanics? I'm going to come to that. Anything else? Okay. Right. Right. Okay. So the first thing you want to understand is there is a huge difference between this phone and a human person, right? Now, if I have this phone, if I move it here, right? If I move it from one place to another, remember the first law? The first law says that every object will be in a state of rest unless it is moved, right, by an unequal force. So it can go from here to here, right, as far as I keep on moving. I can also do a lot of things. I can sort of throw it away and it can go somewhere else, right? But in the physics of a human body, that does not happen. Why? Because we have an organ called as brain. The brain determines what force you are creating. The brain determines how the mechanics are. The brain determines how I am sitting. It is not a biomechanics. It is not just a mechanics, sorry, it is biomechanics. The difference between mechanics and biomechanics is the mechanics will always follow the laws of mechanics, right? But you will not. Say, for example, if I push this, right? If I push this like this, it has to fall down. If I push you, you will not fall down. If you are probably conscious, you will not fall down. Why? Because you want to live. The biology's primary function is to live. It will not allow you to hurt. So it keeps every joint in a particular place for a meaning. The brain decides it, not your local joints. The local joints cannot produce force. Your muscles cannot produce force. The force is created via an impulse coming from the brain. Right? So if you do something, say for example, I suppose you can also hear this. Right? You can hear that, right? What do you think happens inside? Did I put it in the right place? Did I put my joints in the right place? No. It is just a popping sound because of some air is escaping. Nothing else. Right? So there is no changing your biomechanics just by doing that. Right? Then how will I change my biomechanics? By changing my brain. That is, my brain has to think that, okay, I have to change this posture or this way of walking or this or that. It cannot be changed by an external force. That is not how a biology works. That is the first problem in physiotherapy. We study muscles without understanding human brain. Remember, the common example I give everybody is the muscles are like your car tires. The tire is important. It has physical function. It has physical property. That is, it needs air in it. It has to have a pressure, things like that. But they cannot turn. They cannot go forward, backwards. Nothing can happen without the engine. The engine is your brain. So So if you put more air or less air, that doesn't matter. It will not move because the brain has to tell them. That is the most rudimentary mistakes everybody makes in physiotherapy. They think that you can change your fascia. If you can change your fascia, then you should take, if you think you can change your fascia, you should take an MRI to see whether you are just mad. It doesn't change. If it changes for a reason. That's what we call as an adaptation. Adaptation takes time. You can do that. You can go and see it outside if you have a small tree in your home. You can bend it. If you leave it, it will go back to its original place. If you have to change its direction, a lot of people will get a tree like this. They will try to make it stand straight. You have to tie it. For a long time, it has to do that. Right? So that is the most important thing you want to understand. I will talk about chiropractors also. They are the most nonsensical idiots of the medical world. I'll tell you why also. So that is the first part. The next one is the length, right? I don't have a board, so it's difficult for me to show it, but I'll just, give me just a minute. I'll just... Now, I'm not sure how far you can see. Now, if I have, you can see I'm holding two ends. This is one as A and this is B, right? We will assume this as the origin, this as the insertion, right? If I have to stretch it like this, the origin and insertion has to go away, right? But if the origin and insertion is going away and the muscle has become longer, where will my joints be? Can I move my origin and insertion apart? Is it possible? It's a skeleton. We cannot move the origin and insertion. So what you are stretching is, again, not the length of the muscle. You can't change the length of the muscle. It takes years and years, right? Mostly what you are changing is what we call as the threshold of stretch reflex. That is what range your reflex is activated, your stretch reflex is activated. That is what is changed. You can see that in your patient also. The first time you ask them to stretch, they will do it for 50 degrees. You ask them to do it for 10 times, they will go to 60 degrees. And the teacher will tell you that, look, I have changed the length of the muscle or fascia. That's what your chiropractor will also say. No, you cannot change. You have done an accommodation of your stretch reflex. Your stretch reflex is accommodated in the 5 times or 10 times you have done. So that's why you're getting a better range. What it means is, again, you cannot change the peripheral properties. Right? So that is the first thing. And the next thing you want to remember is, there is nothing called as a perfect alignment. That is again a myth. Nobody has a perfect alignment. The biology does not think of it like that. Only a structural engineer thinks like that. Biology is for stability as well as mobility. If you have more and more stable, if you are more and more stable, you cannot move. That is the first rule of structural engineering. Very difficult to make, which is very stable and very mobile. If we have to have it more and more mobile, as the biology is also not a perfect system, it doesn't think of it like how a structural engineer thinks like that. That's why, again, I'm telling you it's biomechanics, not mechanics, right? You cannot have a perfect alignment, so you're not making anything in the right alignment. So a muscle becoming short, a muscle becoming long, these things cannot happen. There was this idiot called as Jada or something like that. He came up with this crossed and uncrossed phenomenon and things like that. These are all rubbish. Your brain will not allow a muscle to go short and become weak in a normal person per se. It may happen in a brain injury, but for pain and things like that, very rare, right? So to have these things are, that's where, that's the point of this classification itself. You need to understand what systems you can change. If you don't understand what systems you can change, we will keep on making the same mistake, right? Uh, So there's another question, stroke, whenever we apply an outside tense muscle spindle, it doesn't change. Nothing happens to any of them. Because these are all controlled by your, muscle spindle is controlled by your brain. It's not controlled by itself. So they don't change by itself. It's a complex phenomenon from your M1 to your anterior horn cells to other parts of your brain. All these things work together along with your environment. So these cannot be changing anything. Electrical stimulation is a passive technique which cannot change a brain. That's why I told you that how to see it as passive and active. If you see it as passive, then there is no way you can change a brain with a passive technique, right? So do you have any questions before I move on? Okay, I'll just, sorry? Yeah. So, so I'm just going to sort of um, go beyond the simple question what we have asked is, so in neurorehabilitation and then pain rehabilitation, what are things we are targeting? What system are we targeting? And remember, the answer should be your whole system. Even though primarily you are targeting the brain, you're changing the whole system, not just the periphery, or not just the brain, or not just the behavior, or not just the emotion. You are changing the whole thing. Primarily, you are targeting your brain. For primarily targeting your brain, what type of treatment you can use? Probably use active treatment, right? That will always have a better value. Why? Because the brain has to learn. When the brain has to learn, it has to learn by itself. Nobody can teach it, right? Remember in 12th standard, your teacher, your mother, everybody told you, study, 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 and probably you did not study much, right? So it's difficult for people from outside to change your brain. It has to happen by yourself. So that happens when you have a good active treatment.
Excuse me, sir, you are not audible, sir.
Can you hear me now? I think my right.
Voice was breaking.
Yes, yes. I think that was my net is slightly unstable. I think.
Yes, sir, you start from now.
Right. So, what I think is you need to change your whole body, probably targeting mostly your brain, which has to be changed for that. Remember, I'm telling whole brain, a whole body, not just the brain, but just for our understanding. Here, I've kept it slightly simple to say that you have to change the brain. If you have to change your brain and the other systems, you have to have an active treatment, not a passive treatment. Passive treatments cannot and have a huge impact on your brain. Sorry. So for anything where you're trying to change your pain, you're trying to change walking, you're trying to change upper limb activities, or how you feel about the pain, all these things, what will best work? Naturally active, right? That is where it is easy to understand physiotherapy as such. It's fairly simple for anybody with a simpler degree to understand medicine. This is the last part I want to emphasize about classification before going into some videos of things which I have shown today. Now, this is where a lot of people make a mistake, right? What is the half-life period? Somebody asked me, how do this chiropractors show before and after video? Who cares about before and after video, right? What you want to tell me is what happened to him in the next 5 days or something like that, right? No disease goes away like that. There is no magic spell where you can give it and change. That's why I told you healing happens in a particular time. Nobody can heal you like that. If you do that, come to me. We will get a Nobel Prize together, right? Nobody can. That is not medically possible. So what is the point? The point is we don't ask half-life period. We don't ask how long this change you showed me last. Are they showing you after 10 days or 1 month? This is where your research will help you in understanding what happens after 10 days. If somebody comes and tells you that I will cure COVID in 1 day, we will all laugh, fall on the ground and laugh. Right? Because we know that COVID takes in 15 days to get better. Again, if somebody comes and tells me if I can get you better from COVID in 15 days, again I will laugh because that is the natural history of the disease. Right? So you need to understand what is the half-life period of this change if you are manipulating. How long was this change going to be there? Is it, who is annotating? Just remove that, please. So, as such, these are the things you need to ask yourself if you are seeing any treatment. What system am I targeting? That's the first question I want to ask. Why? Because if it is peripheral, are you sure that can be changed is your question. Okay, if they say, yes, I have, then ask them, how long? What is the half-life period of that? Right? If they say, no, tomorrow he doesn't have to come, you just run away from those people because they don't have an understanding of what is medicine. There is no treatment like that in the whole world for any disease. Right? And you remember you want a long-term change, sort of a semi-permanent or permanent change. Right? And the last one is, out of all these questions, which are all theoretical questions, you want to have a supporting claim. If they don't have a supporting claim, again, they are just another person who is writing for NDTV or Republic TV, not for medicine, right? Any idiot can talk anything in a TV, but in medicine, you need to have proof to say why you are doing this. If somebody comes and tells you that this is the drug for COVID, will you take? Of course not, because it might be poisonous. It might be actually good. We don't know, right? So you have to prove us that it is working. Remember what happened to hydrochloroquine? They all said that it works, and the research said that it does not work, right? That is why you should not be doing all sorts of nonsensical drugs without any sort of understanding of medicine, right? You need to have supporting evidence for that. If they don't show that, if they say that in my practice, that means that they have no idea of what is medicine, right? So if you ask all these questions, then you are, this is how I think you should utilize this classification system as such, right? And the last point, I just want to give you just some small things about why passive treatments are less effective. Say, for example, ultrasound. Can it heat the underlying tissue? Yes, it can. How long you have to give? 15 minutes. What should be the area? It should be probably 1 millimeter. If I have to heat something which is deep inside, I have to give 15 minutes for probably 1 millimeter, which is there. That is the studies are saying that it changes. The problem is, how long will this change be there? That is the question I told you to ask. That is the half-life period of that. Okay, even if I have heated that, what can I achieve from that? Will that make it that structure pliable? Again, we don't know, because out of a large structure, if you heat a small 1 millimeter structure, will it be more pliable? Probably not. Likewise, clapping, hacking, all these things have a limited half-life period. But at the same time, early mobilization, as I told you, have a longer half-life period. So what will I use? I will always choose a longer half-life period treatment, right? Which has a better outcome. That's what I will choose. The other thing why passive treatments don't work is because the patient has to participate in diseases which we rehabilitate. Remember, a lot of it is rehabilitation. It's not curative. Physiotherapy is a lot of it is rehabilitation. So the patient has to participate. If they don't participate, it doesn't have that much of effect. Say, for example, for low back pain, what is the best treatment? You will see that in any SR, it will say that exercise is the best treatment. Afterwards, you will have probably moderate evidence for manual therapy. And also, again, manual therapy does not change your peripheral system. Again, it changes your brain. It changes the perception. It does not change your brain. That is why I told you need to ask what system I am targeting. As I told you, we cannot change the biomechanics. So what are we changing? Actually, you're changing your perception. You're not changing your local biomechanics. That's why passive treatments are less and less effective. So I will always choose active treatment than anything else, right? I'll just show you some videos of what I have found in the what I have found in the net. So it's not my videos. The viscoelastic property has nothing to do with your lengthening and things like that. This is the problem. We don't understand what's a viscoelastic property and how is that in any way related to length of, right? Length is a measurement of the length of your cells, right? That is the length of your cells of your skin, your length of your the muscles inside your skin, inside your muscles, inside your fascia, inside your tendons, all those things. That cannot be changed. As I told you, you need to go and read about what we call as threshold of activation of your reflex. A lot of people don't understand the neurophysiology of how a muscle works. That's why we have these things, right? Viscoelastic is one of the properties. It's like having a pressure in your tire. The pressure in your tire does not mean that your tire will run. It doesn't matter at all, right? The brain tells you to get it shorter. Why is it telling it to get shorter? That is the question you need to ask. Not whether you are lengthening or not. You have to ask a question. Why is it asking your muscles to go shorter? A muscle did not go short just like that. It went because your brain told it to. Why did it say? That is the question you want to ask, right? So I'll just show some videos of it. Can you see my screen?
No, sir.
Now?
No, your video is on.
Oh, sorry. 1 minute. I think I need to share again. All right, now?
Yes, sir.
Right. So this is what they call as a Lokmat for what we call as robotics, right? A lot of people are astonished, or they are all going gaga over robotics. Now, what I'm going to do is I'm going to use this the questions and things like that which we have asked you, or I've told you to use it. So you can see that it's a spinal cord injury patient, right? You can see them, they are put in a harness. Don't worry about any of these things. It's not very complicated or something like that. You just have to unweigh the patient, and they are just fixed to a supporting structure, and all over the body is attached to that the apparatus basically, right? And you unweigh them, and that's your unweighing system. And then you just start walking, right? So the question I'm going to ask you is, how do we classify this treatment technique first, and what system are they trying to influence, right? So can you just